Yeah, I'm Katie. I'm a consultant clinical psychologist. I work with autistic people. So thinking about adaptations of therapy for autistic people, I guess I'm just thinking quite generally about how we help appointments and therapeutic situations and spaces be accessible to neurodivergent people. So rather than think about a therapy particularly or a particular approach, just thinking about more about the general sort of good practice applications and adaptations. So I think the first thing, a really basic thing, is about being pre-informing the person about what to expect, about where the appointment's going to happen, how long it's going to be, maybe having a pre-conversation or sending some literature so that people know what to expect. Autistic people really struggle with uncertainty, as do lots of people. It's not peculiar to autistic people, so it's just generally quite good practice to let people know what's going to happen and when.
I'm Louisa, I'm one of the doctors working with the Autism Assessment Team. So ideally, from start to finish, when the person's coming to see you, you should be considering the environment that they're in. So things like really busy, loud waiting rooms, changing spaces at the last minute, rooms with really bright lights may be really, really unhelpful for people. So trying to ensure that the senses are accommodated when it comes to considering the room that you're seeing the person in, and quite often seeing the person in the same space can be really helpful. Having work to do or things to look at in between sessions can be really helpful, or resources to go away and look at to reinforce some of the things that you've done. It can be helpful to think about including people around that young person, so parents, friends, family, people that they trust or are happy to work with, so that they have that bit of encouragement and support in looking at the resources that you're sending them, but also so that the people around them can learn and gain a greater understanding of that person as well.
My name is Hannah and I'm the assistant psychologist in the Autism Assessment Team. Yes, I think therapists usually, well, a lot of therapists might think that mindfulness is not working for autistic people, but it's really about kind of adapting it and getting really creative with our clients. So, for example, when we think about breathing techniques, we know that they're really helpful, but if we kind of say to someone, take a deep breath, that they might not kind of agree with you, or they might not think that this is really helpful. So one of the things that I like to do in my sessions, I bring bubbles. So instead of kind of telling them, take a deep breath, we're blowing some bubbles, and it can be quite a nice kind of sensory experience as well, because you can see them, you can have fun around them, so yeah. So when we're thinking about imagery in general, we know that autistic people can have really, really strong kind of attention to detail, and if you're asking them to imagine, for example, walking in the forest, they might really focus on the details and kind of, I guess, lose the gist of what you're trying to guide them towards. So it might be really helpful to kind of break that down by showing them a picture of what you would like them to focus on, instead of guiding them through a meditation script where they're just kind of focusing on lots of different details of, for example, how the forest looks like, what are the trees like.
So when we consider emotional literacy, we're thinking about a person's understanding of their own emotions and those around them. And for autistic people, this can sometimes be difficult. So when thinking about the communication that we're using, we might need to be a little bit more creative. So things like using rating scales or visual aids, or perhaps actually the person identifies their emotions by physical symptoms or behaviours rather than the feelings inside them, can be more helpful to understand their experiences.